Morning, sir. Am I audible? Hello. Okay, sir. Am I
Yes,
audible?
sir. Yeah, you are audible. Please continue with the class.
Hello.
Am I audible, sir? শোনা যাচ্ছে?
Yeah, you are audible. You are audible.
Okay, sir. Thanks. Okay. Sorry for the delay. Okay. Fine. If you just give me 2 minutes, I just settle down with my system. Sorry. Oh. Okay, fine. So, okay, thank you for waiting. It's a little delay today. Okay, let me first of all. Okay. Is the whiteboard visible to you all?
Yes, sir.
Okay, fine. So today we're going to deal with a new topic that is that is just wait. Okay. Anti diarrheal drugs and drugs used for constipation. Okay, are the texts visible to you all?
Yes, sir. It is visible, sir.
Okay, that's pretty fine. Okay, so we're going to start with a new topic. That is, we're going to deal with the drugs, that is the antidiarrheal drugs, as well as the drugs that basically we do use in case of constipation. Okay. So, before we deal with the various pharmacology of the antidiarrheal drugs and the drugs which is used for constipation, so we often use the some laxative for them. Uh, it would be better for us that we should know these two health conditions. What are the two health conditions that we are dealing with today? One is constipation, and the other one is diarrhea. Okay, constipation, and the other one is diarrhea. Isn't it? So, what is constipation and what is diarrhea? You all must be knowing this, but for your reference, constipation, what we can say that the bowel movement in an individual does become less frequent, and as a result, what happens? The stool became difficult to pass. So, in constipations, individual will experience less bowel movement. But in other terms, if we do consider that is diarrhea, what we can find that here the individual will experience bowel movement which becomes loose or watery, and this situation actually leads to pass loose or watery bowel movement. Okay, that means we can say that the individual who have a frequent passage of stool. Okay, so these are the two health conditions which do we find oftenly make anyone's uncomfortable. Okay, so these situations need to be dealt by knowing what its cause to lead to constipation and which cause to lead diarrhea and what are the various consequences of it. Okay, so first of all, we will going to deal with the constipation. Constipation. Now, in order to deal with constipation, okay, in order to deal with constipations, what the agent that basically we use laxatives. Okay, we use laxatives. So these are the agents basically we are using. These are the agents basically we are using, which uh, will help. What we can say, which will help help to increase the water content of the stool. Okay, and thus the cause for which the bowel movement is less will be enhanced. So we will deal with this, but before to that, we should have the knowledge. We should understood what is actually constipation is. So what did we call constipation? We did refer constipation as the bowel movement which becomes the bowel movement, the bowel movement which actually became less. Okay, became less, and as a result, what would happen? The stools became difficult, difficult to pass. Okay. So, what cause? So we have to understand what cause these less bowel movements and what caused the stool to become difficult to pass. Okay, that means we're talking about a situation, as we are talking about a health situation in which it is associated with infrequent passage of stool. Okay, and it's can be defined uh, as per the bowel movement, which is in a week if the bowel movement is less than 3. Okay, if the bowel movement is less than 3, and due to which uh, individual who experience to defecate out the stool, and they required straining to defecate, we do refer or we associated the situation as constipation. Now let's think that what caused, why it's became difficult. Why does it become difficult to defecate? Okay, so what would be the reason? The reason is the stool actually became hard and dry. Okay, the stool is becoming hard and dry, and thus it became it's become difficult for an individual to defecate it easily. Okay. Now the reason is then we have to find out what actually caused to make the stool hard. Okay. So what would be the possibility? The possibility what would happen that the colon absorption of water would be more. What will happen? Colon absorption of water. Okay, colon absorption or colonic absorption of water will be more. Okay, and might be that the okay, the colonic contractions is also slow. Okay. Now, considering this, that when an individual do experience constipation, okay, and that individual is facing difficulties in defecation of its stool matter. The reason behind it that the stool becomes hard and dry, and because of the colon absorptions more amount of water, okay, and the colonic constructions are slow. Okay. Now let's deal with the causes which result in this. Okay, what would be the causes? Okay, what would be the causes? Okay, what would be the causes? Now, if you see the causes, a very first things that should come to our mind is depends upon uh, because of what we can say, because whatever the food we are taking, okay, so it is oftenly said that you should uh, have fiber containing food in your diet. Okay, you should have fiber containing food, or your diet should contain fiber. Okay, and these can help you to pass to have a proper bowel movement. But if in your diet there is a less fiber containing diet, or you are taking less fiber containing diet, so this is one of the cause which may lead to this problem. So we can list them like less fiber containing food. Okay, less fibers containing food. Okay, this is one of the reason might be. Okay, less fiber containing diet. Okay, number two, you oftenly found that because of our sedentary lifestyles, we do avoid physical exercise. So, physical exercise or your body movement is also very much important. Okay. So, lack of physical exercise is also a part which is associated to lead to, or maybe the cause of constipation. Okay. Then, obviously, drug induced. Okay. Drug induced drug induced, then the pregnancy. Pregnancy can also be the cause which may lead to constipation. Okay, then the uh, abuse use of laxatives. Okay, then the more or less what we can say in children, we do find that they try to when due to some reason when the children do passes do have face problem while passing and whose experience pain they try to avoid. Okay, that is referred to the functional constipation. Okay, so ignoring urge to have a bowel evacuation can also may further aggravate the situation. Okay, that is ignoring the urge to have bowel evacuation. Okay, evacuation. Fine. Dehydration. Okay, dehydration. Dehydrations can be caused. Then constipations are also associated with an individual who do suffer some metabolic disorder. So this is an exhaustive list which shows that an individual do experience constipation. Okay. Now, uh, what are the type? Okay, what are the type of constipations might be? Okay, what are the type of constipation might be? Uh, it may be uh, uh, primary, it may be primary, or it may be secondary. Okay, it may be primary or it may be secondary. Okay, just let me. Okay, I'm having issue with the graph pad with not writing. Just give me two minutes and just try to settle it out. Okay, it's fine. Sorry. Okay, so we were discussing about the types. Okay, the types. What would be the types? Types kiki hote pare. Okay, the types. One is the primary types. Okay, primary constipation. Then the other one is secondary constipation. Okay, what is primary constipation? In case of primary constipation, it is actually include the normal transit constipation. Okay, it include the normal transit constipation. Okay, normal transit constipation. Uh, Constipation, and this is basically to experience by individual because of what we can say inadequate fiber containing food. Okay, in adequate fiber containing food, or it might be due to intake of less amount of water. Okay, intake of less amount of water. Okay, And as a result, what happened in this case, the individual who experience slow transits, okay, they do experience slow transits, okay, do experience slow transit, as well as they do experience dyssynergia, okay, they do experience pelvic floor dyssynergia, okay, dyssynergia. What does it mean? It just means that actually it is it involve the lower abdomen. We can see uh, upper to lower abdomen, that is the pelvic region. Because of this, there is an uncoordinated movement. Okay, what I the structure, the tissue or the area which is supported by the pelvic floor. Okay, it's involved an uncoordination movement. Okay, it's lead to an uncoordination movement to the structure, the organ of that particular part that is like the bladder or the rectum or the other pelvic organ. And because of its uncoordinate muscle movement, it's to impair the normal transit. It makes slow, and thus an individual will experience constipation. So this is a primary type of constipation. Now, in case of secondary type of constipation, secondary type of constipation is basically drug induced. It is drug induced. This one is drug induced constipation. Okay, drug induced constipations like opioid induced constipations. Okay. And it may also due to what we can say due to individual who suffer from any sort of metabolic disorder. Okay, metabolic disorder. Okay, metabolic disorder. For an example, hypothyroidism. Okay, in case of hypothyroidism. Uh, okay, thyroid induced thyroidism, and it may also occur in individuals who have neurological disorder. Okay, neurological disorder. Okay, having neurological disorder. Okay, and because of obstruction to the bowel. Okay, uh, if someone is having cancer, it may also precipitate to secondary type of constipation. So these are the major constipation can be broadly on the basis of their cause. It can be primary type of constipation and secondary type of constipation. In generally, what we can say, the primary type of constipation in which it's precipitated because of inadequate proper fiber containing food and less water intake. And in case of secondary type of constipation, what we can say that it's basically associated with drug induced or other pathological alteration in the body due to metabolic disorder, neurological disorder, and so on. Okay. Now let's talk about what how the pathogenesis of constipation do occur. Okay, what we have, it is actually the mechanism behind it is actually it's actually it's actually alter the stool. It is altering the stool what happens in case of an altered stool consistency. Some of the external factors, okay, some of the external factors like lack of exercise, external factors like lack of lack of exercise, than what we can say, inadequate fluid intake. Okay, than what we can say intake of fiber in diet. Okay. Uh, these basically precipitate a primary type of constipation. Okay, it's precipitate primary type of constipations. Because of this, what happened? Because of this, the stool consistency actually affected. Okay, stool consistency is actually affected, and some of the internal changes do occur within the transit of colonic content, like it involved in the slow passage of the stool. Okay, slow passage. Okay, slow passage of stool. Okay, it do involve in slow passage of stool, and as a result, what happen? It will lead to prolonged staying, okay, prolonged staying of the content, and as a result, what will happen? It will lead to prolonged absorption. Okay, prolonged absorption of water. Okay, because of this prolonged absorption of water, and these actually, what does it do? Due to this, so we have to keep in this mind that colonic secretion and absorption imbalance is playing a very important role by regulating the uh, mm, consistency of stool, which depend upon the bowel motility. Okay, and because of this, what will happen? Prolonged absorptions of water, it will lead to make the stool dry and hard. Okay, it will make a painful movement. Okay, experience a painful defecation. It's going to experience a painful defecations. Okay, and when we don't have complete defecations in terms, then obviously the individual to experience the sensation of incomplete or irregular bowel movement. And this stool consistency, which is depending upon this factors being associated with the constipation. Now, by the intrinsic innervation. And this intrinsic innervation is actually what we can say. It is actually involved in regulating the bowel motility. So any impair to this intrinsic innervations may alter the bowel motility. Okay, it's going to alter the bowel motility. I hope you must be remembering in the last class we will talk about the imperfect bowel system. Okay, so what we can say that the possible cause which may alter the bowel motility is that uh, uh, there may be compromise in the effective peristalsis of the bowel, which is being controlled basically by the intrinsic intrinsic innervation. Okay, intrinsic innervation. So any sort of alterations, okay, any sort of alterations to this may lead to what we can say ineffective peristalsis. Okay, ineffective peristalsis. Okay, so drugs like what we can say, calcium channel blockers, antispasmodic drugs, they do involve. Okay, they do involve in altering the autonomic outflow, and also involve in the bowel muscle construction. So some of the effects, which is basically altering, okay, or do involve in altering the intrinsic innervations, leading to ineffective peristalsis. Okay, so it is due to drugs. Okay, drugs, as I have already mentioned, in case of secondary precipitation of constipation. So, like a situation like hypothyroidism, okay, hypothyroidism, that means the involvement of your endocrine pathology also. what will happen? It's going to down regulate the. It's going to down regulate. It's going to down regulate the bowel motility. The bowel motility. Okay, bowel motility, and the neurological pathology can also involve in the precipitation, which do involve in altering the bowel motility. Okay, neurological pathology also. Okay, and so what we can see that these are the some of the things. Okay, these are the some of the involvement of mechanisms which leading to the ineffective peristalsis. And if there is an ineffective peristalsis, what will happen? It will be difficult. It will be difficult for for the passage of stool. Okay, it will be difficult for the passage of stool. Okay, passage of stool, and thus it against leading to constipation. So we can see that that the pathogenesis, the growth of pathogenesis leading to constipation of any individuals involve certain external and certain internal factors which associated to alter the stool consistency and mm, the mechanism which do involve in altering the bowel motility, leading to ineffective peristalsis, and a person in such cases to experience constipation. So this is an overall outlook of constipation. So we now we are in a status to know that what are the causes, what are the actually the factors that are associated which may lead to the hardening of the stool and lead to constipations. Now we have to think in another way that a person is experiencing whatever the situation that he or she is suffering from it, and in order to get relief from this discomfort, he or she need to be approached with a proper management of proper prescribed drugs. So let's talk about the various drugs which can be utilized or choosing the appropriate or the drug of choice for the treatment of this health condition which is known as constipation. Okay, fine. So, okay. Okay. Um, Fine. So let's talk about where is my slide? Okay, here it is. Okay. So drug for constipation. Now we will talk about the drugs which can use for constipation. Okay. So oftenly we do uh, categorize them. Okay. Oftenly we do categorize them as laxatives or aperients, or we call them purgatives or capsules. Okay, this distinction is basically depending upon their intensity of action. Okay, intensity of action. Okay, so one is the milder in action, that is the laxative. Okay, these are milder in action, and the other would show a strong action. Okay, would show a strong action. Okay, and thus helping in elimination of shock and form stool. Okay, so drugs for constipation is basically what we do. They are the agents which actually promote the evacuation of the bowel. Okay, they do promote the evacuation of the bowel. Okay. So here we have that on the basis of their intensity of action, the milder actions we do use in certain cases, If we use laxatives, then in certain cases we use the strong actions of to evacuate the bowel, that are the targets. Okay. Now, possibly we have to think that the drugs or the agent that we are using for constipation, what actually they does. Okay, what actually they does. How they how does they generally act? Okay, how they are acting. Okay, how does they generally acting? Okay, now let's see. So what we know that individual who experience constipation, in that individual the stool become hard and dry. Okay, the stool become hard and dry. So, in order to evacuate, what would be the behind concept? The behind concept is to increase the water content of the stool. The basic thing is would be to increase the water content. Okay, increase the water content of the stool for for an easy evacuation. Okay, for an easy evacuation. Okay, so how this could be achieved? Okay, how this could be achieved means whatever the agent, whatever the drugs we are using as a laxative or a targeting, their main motive would be the increasing the water content of the stool. How it could be achieved? Okay, so we can say that the hydrophilic, okay, the hydrophilic and osmotic activity of the, okay, hydrophilic, okay, hydrophilic or the osmotic activity, okay, of the agent will help to retain more amount of water and electrolyte. Okay, so retaining more amount of water and electrolyte will fulfill the needs, which will enhance the water content of the stool. Okay, they need to act on the intestinal mucosa. Okay, they need to act on the intestinal mucosa, and they need to prevent the net absorption of water as well as electrolyte. Okay, they will prevent the absorption. Okay, they need to act on their intestinal mucosa, and as a result, what will happen? They will prevent the further absorption, because what I told you, that the imbalance between the secretion and the absorption play a very vital role. So all these agents is going to work in that manner that will effectively increase the water content of the stool, so that soft and firm stool is formed. It's not that excess amount of water accumulations, and obviously what we have seen, that it may alter the stool consistency as well as the bowel motility, and as a result what would happen, it may leads to the other side of the coin, that is diarrhea. But we need to utilize an agent, we need to utilize an drug that would control all those things. Okay. So nextly, what we have, it should involve in increasing the intestinal transit activity. Okay, so it should also involve in increasing the intestinal transit activity. That is the propulsive movement. Okay, and more and moreover, that it should decrease the time of absorption. Okay, so as it is enhancing the gastric motility the transit, so gastric enzyme also needed to be controlled or regulated. So the time for absorption need to be decreased. Okay, time for absorption time. Okay, absorption time need to be decreased. Okay. Absorption time need to be decreased. So this is the possible in a nutshell, we can say that this is the possible way these laxatives or the purgatives will walk onto the colonic content for forming a soft and a firm stool for its easy evacuation. Okay. Now, on the basis of this, we will talk about the various different classification of drugs under this. So let's talk about the various classification of drugs and their specific involvement while dealing with the colonic content for easy evacuation during any constipations being experienced by any individual. Okay, now let's talk about the classification. Okay, let's talk about the classification of the drugs. What we have, classification of the drugs. So we have bulk forming. Okay, bulk forming agent. Okay, bulk forming. One of the part of our dietary content, that is the dietary fiber. Okay, the dietary fibers. Okay, the dietary fibers like the bran. Okay, the dietary, sorry, it's not bran, it's bran. Okay, bran. Okay, it is nothing but it is the what we can say the residual part of the flow. Okay, the residual. Okay, the residual part of the flow. Okay, so we have dietary fiber. Okay, dietary fiber brand. We have psyllium plantago. You all must be knowing this. Okay, Isabel, you all must be knowing, or in your terms, often you must have consumed this or used this. Okay, uh, then we have methyl cellulose. Okay, methyl cellulose. We have methyl cellulose. Okay, these are all bulk forming. Okay, these are all bulk forming uh, agent which is used for any sort of constipation. Methyl cellulose, which is a derivative of that. Okay. Nextly, we have stool. Okay, nextly we have stool softener. Okay, stool softener. Under stool softener, what we have? We have docusets. Okay, docusets. That is docusets, often we call DOS. That is nothing but it is dioctyl, dioctyl, dioctyl sodium. Okay, dioctyl sodium sulfosuccinate. Okay, sulfosuccinate. Okay. Uh, then we have liquid paraffin. We have liquid paraffin. So these are uh, stool softener. Okay, these are the stool softener which can be used in case of what we can say, in case of constipation. Okay, fine. Then we have stimulant targeting. What we have stimulant. We have stimulant targeting. Stimulant targeting. We have stimulant targeting. What we have stimulant targeting. So in case of stimulant targeting, we have what we can say. We have mm, uh, diphenyl methanes, one class under stimulant targetives. Okay, and uh, then we have then we have uh, 5-HT4 receptor agonist. Okay, receptor agonist under this class. Okay, so these are some of the stimulant targetives. Okay, along with this phenylmethane and 5-HT receptor antagonists, we do also have what we can say those which is actually obtained, which is known as imodins. Okay, imodins. Okay, imodins that are they are the okay anthraquinones, anthraquinones, anthraquinones. Okay, anthraquinones. These are also stimulant targeted. So stimulant targeted.
Glycosides regular.
Yes, exactly. Yes. Okay. So we have stimulant targetives. So stimulant purgatives actually, what does it do? It's actually involved in irritating the intestinal mucosa. Okay, it's involved in the irritating the intestinal mucosa. Okay, to involve in irritating the intestinal mucosa. And as a result, what happens? It increases. Okay, it increases the motility, or increases the motility. And how does it do? By affecting. Okay, it's do affecting, or rather, we can say that they act on the mind-brain plexus. If you remember the last class, I have shown you with the help of a diagram that how the peristalsis, as I have just mentioned in the earlier slide also. So these stimulating purgatives actually show their actions possibly by irritating the mucosa, by irritating the intestinal mucosa. Okay, and which is actually helping in increasing the motility on acting on their minding. Okay, so, uh, along with this, we have osmotic purgatives. Okay, we also have osmotic purgatives. Osmotic purgatives can be also used in case of constipation or osmotic purgatives. Okay, osmotic purgatives. What we have magnesium salt. Okay. Magnesium salts. Okay, we have magnesium salt, we have sodium salt, which can be used. Okay, and lactulose also. They all belong to the class of osmotic purgatives. Now let's deal with each and every this drug which basically used to treat constipation. Okay. Now we will deal with the first one, that is the dietary fibers. Okay, the dietary fibers. Okay, dietary fibers. We have the dietary fibers. The dietary fibers. Okay, the dietary fibers. So what? How this bulk forming agent? How this bulk forming agent is actually working as a drug which is used to promote the evacuation problem. Okay, how they are bound. Okay, and just remember that these are some of the these bulk forming agents are unabsorbable in the colonic. Okay, they are unabsorbable. Okay, so how do they act? Okay, now let's for an instant just consider what happened during constipation. Okay, let's take what happened during constipation. What happened during constipation? What happened during constipation? Suppose let's have a rough diagram of the colonic structure. So during constipation, what we know that the stool became dry and hard. Okay, the stool became dry and hard. For an instant, just imagine the stool became dry and hard because what we know that in case it's leaked because of more amount of water is being absorbed. Okay, more amount of water has been absorbed. More amount of water absorbed, and along with the other factors that we have mentioned in our earlier slides. Okay. So, because of the stool became dry and hard, okay, it's became difficult for its difficult to defecate out normally. Okay. Thus, utilizing the bulk forming agent. Okay. Now, when we use bulk forming agent, what will happen? Okay, when we going to use the bulk forming agents, what's going to happen? Okay, sorry. Okay, these dietary fibers or the brains are actually they do contain cellulose, lignin, starch, pectin, and the glycoproteins and other polysaccharides. And what actually it does, okay, it's actually retake. Okay, suppose if we are giving the dietary fibers, okay, is actually what is actually is doing, it's actually help to absorb more amount of water. Okay, it's actually help to absorb more amount of water. Okay, it's actually help in absorbing more amount of water in the intestine. And as a result, what would happen? As a result, you see, if it absorb more amount of water, it will within the structure they're going to swell up. Okay, they're going to swell up. They're going to swell up because of more amount of absorption they are doing. They're going to swell up. Their water content will be increases. Okay, and whatever the colonic contain. Okay, whatever the colonic contain, it will what will happen? It's going to act osmotically. Okay, it's going to act osmotically, and this also may lead the bacterial degradation of its constituent, and as a result, what would happen? These do help to retain more amount of water, and as it swells, okay, as it's going to be swelled, making the consistency of the stool, making it becomes soft because of as more amount of water they retain, and as the dietary fibers they get swelled up, actually they pushes. Okay, they try to push this outside the colonic, and thus help in easy defecation, and thus it help in easy defecation. So in this way you can see that the bulk forming agent actually help in mm, helping in desiccations of the hard and the dry stool by absorbing more amount of water in the intestine. They get swell, they get increase the water content of the feces, and thus makes it much more softer and a form stool, and thus facilitating the colonic transit. And as well as it's also involved in hospitality active products which may be formed by the colonic bacterial degradation, and thus it also helps to retain lower amount of water and easy defecations may achieve. So this is how a bulk, okay, this is how a bulk forming agent, the bulk forming fibers help to relieve from constipation. Okay, so we have but along with this, if you use prolonged, okay, if you use, uh, okay, just give me a while. I had a call. Okay, just give me a
Okay, sir.
Okay, sorry, student, I had an important call. For that reason, I need to receive it. Okay, fine. So this is where a bulk forming fibers is basically help to relieve an individual from constipation. And so on. So now we need to think about that. What are the cases in which we can use this dietary fiber? That is, as it is an important part of our diet. Okay. Basically, what this is one of the appropriate measures, okay? Because if we lack of having dietary fiber in our diet, it's may lead to constipation. So this this situation of constipation is also aggravated basically being observed in children, okay, who do involve when they do experience pain while evacuating their bowel, they they close their sphincter. Okay, they try to avoid or slow their voluntary try to close their sphincter to avoid this bowel evacuation. Okay, that means this dietary fibers, one of the appropriate approach, rather we can say, which can be used in case of functional constipation. Okay, functional constipation. Okay, and they as these agents are also help in reducing the intramural pressures. Okay, where you will find that within the colonic structure in the sigmoid colons where the colonic content gets stored. Okay, they help to reduce. Okay, they do help to reduce the rectosigmoid intramural pressures. Okay, then that does it also can be helps to relieve the symptoms of irritable bowel syndromes also. Okay, and they can be also used for what we can say. They can they can be used in case of chronic diverticulosis. Okay, they can also can be used in case of chronic diverticulosis. Okay. What is diverticulosis? Diverticulosis is nothing but it is actually the situation which do prevail in any individual who do have inflamed pouch, okay, inflamed pouch in their intestines, okay. That means inflammations of their intestines, okay, inflammations of their intestines, and this is this actually occur because of unhealthy or because of your sedentary lifestyles. Okay, actually, people do have high fat diets and does not care about their proper fiber containing diet. Okay, and low physical activity. So it may lead to chronic diverticulosis, and in this case also, it can be improved by having dietary fibers in their food. Okay, uh, so these are some of the usefulness to have dietary fibers in your food. So just pay attention that you all people should have dietary fibers in your diet. Okay, what are the drawbacks? Okay, so nothing is left with any other drawbacks on the other side of the coin. So uh, so uh, uh, what is that? The brine is generally safe, but you will find that they are unpalatable, and oftenly they do required in a large quantity. Okay, the large quantity needs to be ingested. So this is a little bit cumbersome for a patients to be administered. Okay, and more or less they do take the duration would a little bit long to show its effect. Okay, and more eventually, what we can say that these actually does not prevent the constipated stool, but it will help rather to prevent the constipation. Okay. Uh, so these are some of the drawbacks that we should remember. Along with this, if fecal impaction is chances to be precipitated at that situation, it won't be useful. Okay. Okay. Now, in dietary, in this class of drugs, the commonly that we use, we have already mentioned, like isabgols. Okay, and you all know that psyllium husk, which is basically derived from the seed of Plantago house. Okay, which is known as the isabgola, and they are nothing but they are the natural colloidal mucilage. Okay, and while they help in forming a gelatinous mass by absorbing more amount of water. Okay, and they also help in increasing the bacterial mass and help in softening the faces. Next, in this class, we have methyl cellulose. Methyl cellulose, they are nothing but they are the semi-synthetic colloidal hydrophilic derivative of cellulose. And basically, they help to what we can say, they help to retain more amount of or absorb more amount of water and thus help in easy evacuation. So these are the first class or the first class of drugs that we have, or the preferentiable choices that can available for an individual to treat this health conditions of constipation. Now, nextly, we're going to talk about the stool softener. Okay, softener, stool softener. Stool softener. Stool softener, what we have? Stool softener, we have glucosets, we have glucosets, okay, we have glucosets. Okay. And glucosate, it is actually it is an anionic surfactant. Okay, it is actually an anionic surfactants which do show their actions actually by reducing the surface tension of the stool, and you will find that this actually help in what we can say, it allow the intestinal fluids and fatty substance to penetrate into the fecal matter. Okay, it's help into so thus a well soft and firm stool can be achieved. So let's talk about that how actually it works. Okay, let's okay, how does it have, actually it's working. So sorry. So let's see. So what we know, let's again consider that particular diagram. Okay. So uh, suppose I'm not drawing it's repeatedly, so I will just get uh, to that particular thing where it's actually working. So actually, what we can say that these particular agent, okay, this stool softener, these stool softener, what is actually it's doing? The stool softener is actually increase the intestinal secretion. Okay, it is actually increases the intestinal secretion. It is actually increases the intestinal secretion. It's to involve in increasing the intestinal secretion. Okay, and it's also help in reducing. Okay, also help in reducing the surface surface tension. Okay, the surface film tension uh, of the interfacing liquid content of the bowel. Okay, and it also help uh, to increase the penetration. Okay, also help in increasing the penetration. Okay, penetration of the intestinal secretions into the penetration into the fecal matter. Okay, fecal matter. Okay, very important. So as this, what would happen? It will makes the stool much more softer. Okay, the stool will become soft. Okay, the stool will become soft, and it can be easily defeated. Now, what we have for this food softener, as I just told you, that we can use glucosides. We can use glucosides. They are the nothing but they are the anionic surfactants. Okay, and they Also, okay, they do have their detergent action, which actually involve in disrupting the mucosal barrier. Okay, they do involve in disrupting the mucosal barrier. Okay, disrupting the mucosal barrier. Okay, they disrupt the mucosal barrier, and as a result, what will happen? It may involve in absorptions of many non-absorbable drugs. Okay, so it is not advisable that when we use Lucozade, we should not use the liquid paraffin. Okay, should not be should not be used with this. Okay, some of the side effects associated with this stool softeners are usually individual to experience cramp. Okay, usually experience cramps and abdominal pain, abdominal pain. Okay, and in case of liquid paraffin is also, and it can be used as a stool softener. Okay, it is nothing but it is actually a mixture of petroleum hydrocarbon. Okay, it's a mixture of petroleum hydrocarbon. Okay, it's a mixture of petroleum hydrocarbon hydrocarbons. So basically, you will find that its utilization do take time because it takes near about 2 to 3 days, okay, to get the food softened. Okay, and it also helps in making the fecal matter. It actually it's actually coating the fecal matter. It's coated the fecal matter, and it's actually, if you see, actually it's actually coat them. Okay, and actually helping in lubricate. Okay, it's actually lubricating it for an easy defecation. Okay, easy defecation. Okay. Number of drawbacks or disadvantages are there for the use of liquid paraffins, like it is what we can say, it is unpleasant to swallow. Okay, it is unpleasant to swallow. Okay, and because as I just mentioned you that it's actually coating with get coated with that what we can say the colonic content and help in easy evacuation of this, and because of its oily consistency, it's unpleasant to swallow, and individual to experience. Okay, individual, it's because it's this oily consistency also comes along with the discharge, so it is a little bit uncomfortable. Okay, it is little bit uncomfortable for an individual, the individual who use to treat the constipation, and it can also get into the lungs. Okay, it can also get into the lungs, and it may lead to lipid pneumonia. Okay, then it may also, as because of its oily consistency, it is lubricating the colonic content and helping to easy evacuation. It also may involve in interfering with the they act as a barrier. They do act as a barrier, and thus they can also interfere. They can also interfere with the healing process. Okay, they are also healing process in the region. So, depending upon the number of what we can say, this sort of an advantage, their use should be limited as per the needs. Okay, so we have just talked about the dietary fibers, isabgol, beta-cellulose, and stool softener, and some of the cases we did need what we can say that we need to use strong action agent which will help to evacuate. For an example, suppose you are opting for or you have been opt for a diagnostic procedure like colonoscopy. So evacuations of the colon is required. For that reason, we will be requiring a strong action agent which will be help to desiccate the colonic content. Okay. So we have the next class that is the stimulant targeting. Okay, stimulant targeting, stimulant targeting, stimulant targeting. What we have stimulant targeting. Okay. Now in stimulant targetives, as I have just mentioned at the start while talking about the classification, that we have diphenyl methane. Okay, we have what we can say. We have diphenyl methane. We have anthraquinones. We have 5-HT4 receptor agonist, and we have the fixed oil, the castor oil can be used as a stimulant. Now let's see that how actually this stimulant targeting actually work. Okay, as I mentioned that these are the agents. Okay, these are the agents which actually irritate. Okay, they are involved in irritating the intestinal mucosa. Okay, they are actually involved in irritating the intestinal mucosa. Okay, they involve in irritating the intestinal mucosa. Okay, sorry, and they increases. Okay, they increases the motility. Okay, they increases the motility. Okay, by acting onto the mandric gland. Now you must be. I'm not showing that particular thing which I have already discussed in the earlier classes. So you will be find that what it calls actually you will find that this leads to the accumulation of more amount of water, okay, and accumulation of more amount of water and electrolyte, and thus you can understood that these fulfill the needs. Okay, so accumulation of more amount of water because of it and electrolyte. Okay, uh, because these are the agents which is acting on the epithelial mucosa of and thus they do more or less involve in altering. Okay, they do more or less involve in altering the what we can say the absorptive, okay, the absorptive and the secretory activity. Okay, secretory activity. Okay, of the mucosal cell. Of the mucosal cell. So, okay. Moreover, you will find that this agent do involve in inhibiting the sodium potassium ATPase at the basilical membrane, because as I just mentioned that they alter the absorptive and the secretory activity in the mucosal cells, in the absorptive cells. So they do inhibit in the inhibition of the sodium potassium. Okay, what they do, they inhibit they inhibit the sodium potassium ATPase. Okay, they inhibit the sodium potassium ATPase at the basal membrane. Okay, and thus what we can say that it's the transportation of sodium as well as the accompanied with the water in the interstitium is actually reduces. Okay, so they actually involve in regulating in the absorptive as well as the secreting activity. Okay, and obviously what we can say that they will involve in the increasing the secretion. Okay, they will involve in the secretions, and all these factors, if you do observe, all these factors, okay, all these factors in this colonic structure, what will do? That means increasing of intestinal secretions, okay, increase of intestinal secretions, and inhibition of the sodium potassium TPase, and thus they also enhancing the propulsive motility will make the stool will be become much more soft because of much more amount of water and electrolyte, and thus we can say that it will be easy if the stool became soft. Okay, the stool became soft, and it will be easy for defecation. Okay, so this is how this stimulant purgatives are actually working. Okay, this is how the stimulant purgatives are actually. But apart with this, they do show as they involve in regulating the absorptive and secretory activity of the structure. So apart with this, they also involve in certain side effects. That means you will find that a large doses of stimulating purgatives will be needed. Okay, needed for the purgations, and thus it may result in electrolyte imbalance also. Some of the cases, like because of excess secretions, it may also lead to hypokalemia. Okay, and they can also they, rather we can also say that they are not very much efficient, or should be prevent this stimulant purgative should be prevent in patients who are pregnant, or the pregnant mothers should be avoided by using use of this stimulant purgatives. Okay, so these are some of the things, that the basic things that we should remember regarding the stimulant purgatives. Okay. Now let's see what we have. We have diphenylmethane. Okay. So diphenylmethane is one of the stimulant purgatives that we can use. Okay, the diphenylmethane. What we know that they actually, okay, phenyl methane. In this class, what we have in this class, we have bisacodine. Okay, we have bisacodine. Okay, what we have bisacodine. We have bisacodine. Okay, bisacodine. This is one of the diphenylmethane. Bisacodine is actually get activated by deacetylation in the what we can say, in the intestine. Okay, and their primary site of action is in the colon, where it actually they involve in irritating the mucosa, and do involve in producing mild inflammation and increasing the secretions. Okay, and they do so by taking time of 6 to 8 hours to easily evacuate the formed stool, and they can be given in the form of surface suppository, which is actually involved in irritating the anal as well as the rectal mucosa. Okay, some of the adverse effects associated with the viscodil, we can say that individual do experience cramps. Okay, and they do also experience allergic reactions. Okay, they do experience allergic reactions. Okay, skin rashes. Okay, skin rashes are some of the okay, some of the allergic reactions, like the skin rashes may occur. Okay, uh, one more thing, that as it can be given in the form of suppository, so the chances of inflammation, okay, the chances of inflammation and mucosal damage cannot be cannot be avoided. Okay, Secondly, we have sodium picosulfate. Okay, what we have? We have sodium picosulfate. Sodium picosulfate we are having. Uh, okay, basically it gets hydrolyzed by the colonic bacteria. Okay, the colonic bacteria is actually hydrolyze them. Okay, the colonic bacteria. Okay, the colonic bacteria basically hydrolyze them to their active form. Okay, to their active form, and these actually involve in irritating the or directly acting onto the mindric neurons for the mm, gastric motility and help in the bowel movement. Okay, it basically takes about 6 to 12 hours after an overdose. Okay, uh, some of the anthraquine. Okay, anthraquinone. Okay, anthraquinone you will must be knowing that the sena. Okay, anthraquinone like we have what we can say. We have Sena. Okay, we have Sena and we have what we can say. We can have Cascara Sagarda. Okay, actually, what they are the anthraquinone glycosides. Okay, they are nothing but they are the anthraquinone glycosides, which is oftenly called as the pneumodins. Okay, and they are unabsorbed in the small intestines and they actually involve to get activated by the bacterial degradation to its active forms and thus they do show their activity and leads to easy defecations and more or less it will take near about 6 to 8 hours to show their action. Okay, some of the associated, what we can say, associated side effects are cramps and skin rashes. Okay, and chronic use of these drugs may lead to mucosal pigmentation also. The next one we have 5-HT4 receptor antagonist. 5-HT4 receptor antagonist. Okay, antagonist we have 5 receptor antagonist. Which what we have two calorified. Okay, two calorified. Okay, two calorified. You can see that these are the 5-HT receptor antagonists. If you remember that the P584 receptor actually present at the pre junction, okay, at the pre junction of the interneuron. If you remember, pre junction interneuron they present, and these 584 receptors is actually they activate those receptors on the intrinsic interneurons and basically though they do involve while enhancing the acetylcholine secretions and thus help in the gastric motility. Okay. Some of the side effects of these 5-HT4 receptors are like headache, dizziness, fatigue, or abdominal pain. Okay. Along with this, if you remember that while talking about this in case of we have also did mention that okay, along with this, we have another drug which has been withdrawn, that is the tegaseride. You all must be knowing this. Tegaserods, because this is one of the drugs which has been shown to precipitate heart attack and stroke. For them, it has been withdrawn from the market. Tegaserides. Okay. Nextly, what we have, nextly we will move to the uh, last class of drugs which can be used for constipation are the osmotic, okay, osmotic purgative. We have osmotic purgative. Let's see osmotic purgative. What does osmotic purgative actually do? So, osmotic purgatives actually uh, they retain more water osmotically and help in increasing the peristalsis indirectly. Okay, so if you just see this, what happened? These osmotic purgatives, okay, these osmotic purgatives, okay, these osmotic purgatives are they are they are the solutes. Okay, they are the solutes which are actually not absorbed. They are not actually absorbed in the intestine. Okay, that means intestine. Okay, and they actually retain more amount of water. They're going to retain more amount of water automatically. Okay, and also in increasing the peristalsis. They're going to increase the peristalsis. Okay, in that. Now let's see what actually do. So during the constipation, we know that the individual unable to defecate properly because of the hardening of the stool. Okay, now while when we give, okay, when we give osmotics, okay, when we give this osmotic purgatives, okay, what happens? These solutes actually retain. Suppose these are the water molecules. Okay, these are the water molecules. So what happens? They do retain. Okay, they osmotically they retains more amount of water in the unit. Okay, and as a result, what would happen because of this uh, these solid get attached with the fecal matters. They're going to be attached with the fecal matters, and they're going to uh, attach with the fecal matter. Okay, they're going to attach with the fecal matter, and because as they are retaining more amount of water, okay, these solids which are unabsorbable at the polaric structure, they became they they actually as they retain more amount of water, what will happen? The fecal matter, they because of this watery fluid, what will happen? The fecal matter will swell up. Okay, the fecal matter is going to swell up. Okay, and the fecal matter is going to swell up. And as we already know that the distension, okay, the distension, the distension, the distension indirectly also involved in the enteric nervous system to increase the motility, okay, and increase the motility by the you all know by the release of acetylcholine, by the involvement of the neuronal enteric nervous system. So what would happen? It will increase. As a result, it will increase. It's going to increase the propulsive motility. Okay, it's going to increase the propulsive motility, and in this way, this osmotic pervative what will happen. It will, along with this, it's also making the stool soft. Okay, it's also because more amount of water is there, so more the solute will get adhere onto the surface of this fecal matter. Okay, and it will make the consistency. At the same time, what will happen? The consistency of the stool also becomes soft. Okay, the consistency of the stool is also becoming soft. Okay, then as a result, because of all this additional effect, what will happen? It will be easy for defecation. It will or it will be defecate out easily. So this is how the various drugs which is used in case of as a osmotic purgative are show their action. So we know that we have non-absorbable. One is non-absorbable non-absorbable salt we have, which are also known as saline purgative. What we call it? We call it as a saline purgative. Nobody saline purgative. Okay, so what are those? These are like the magnesium salt and sodium salt, which I mentioned you at the time of classification. Then we do have what we can say. We do have non-absorbable sugar. Okay, non-absorbable sugar. Non-absorbable sugar also. Non-absorbable sugar. Non-absorbable sugars like lactulose. Okay, lactulose. We have lactulose and sorbitol. Okay, sorbitol. We can have this can be also used. Okay, this can also be used. Okay. Uh, the non-absorbable salts like the magnesium salts or all this actually and they are the strong they are stronger in action, so they will involve in a complete emptying of the bowels. Okay, emptying of the bowels. Okay, so So these are the things how this osmotic purgatives as well as two categorical drugs. One is your non-absorbable salt, that is the saline purgatives, and other one is the what we can say the non-absorbable sugar. But do you remember one thing that uh, uh, this saline purgative, okay, this saline purgative, because of their mm, uh, 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 they are stronger in action. So these osmotic purgatives, you would find that they should be used as a limited restriction because our sole purpose is not to produce the watery stool until and unless the required need of bowel evacuation is required. For example, these classes of laxatives, which are in stronger action, basically can be preferred for preparing the bowel before any sort of surgery. As I mentioned while when I was talking about classification, that means someone is being prescribed for a colonoscopy. During that, we can give this strong purgatives. Okay, this osmotic purgatives. Okay, and this can be also used in case someone who have drug poisoning. Okay, okay, and for this we can use osmotic purgative also. Okay, some of the common side effects associated with this drugs like individual to experience flatulence. Okay, cram is one of the commonest side effect associated with all the drug agents basically we use in case of constipation. Uh, and as they are directly linked with involvement of the enteric nervous system, so some of the drugs which use are also you will find that they also makes the people to feel nausea and vomit. So these are the associated things that we have just discussed. The one part of today's discussion. That means the drugs which are used for in case of diarrhea. We will deal with this diarrhea because the time is already over. We now could just start with a new topic. So these are the various drugs that we can find in case of constipation. So constipation is one of the discomfortable symptoms individual to experience, and to them, depending upon the type of constipation, depending upon the cause, the selection of the laxatives or the purgatives can be taken into consideration for a better approach, so that individual patient who experience constipations can be relieved from this discomfort. So, in our next class, we will talk about the next topic about the diarrhea. On the other side of the point, we have just mentioned in constipation, we have seen that is the less it's involved with, it's related to the less bowel movement. But in case on the other terms, as we have discussed much more about the constipation, so it will be easy to understand in a better half how the diarrhea cause, because in which you will find that it is because of the more frequent bowel movement, okay, and which cause poorly formed stool. Okay, poorly formed stool means watery stool being excreted out, and now we have to give an agent that will interfere with the absorption as well as the secretion activity of the colonic structures, and thus it will help in controlling the consistency, and along with this, it's going to involve in the regulating the altered motility, so that we can check the frequently bowel movement. So these are the things for today's class we have. So if you have any sort of queries regarding, then you can come with those queries, or else we can end here, and with a suitable time we can have the next one. Okay, yes. Yes, Shubhodas, is it clear? Shubhodas, Twinkle, Prabhakas.
ইয়েস স্যার, এমনি তো স্যার ক্লিয়ার, মানে পার্টগুলো যেগুলো স্যার বোঝার হলো এবার স্যার পড়তে হবে এগুলো।
Obviously পড়তে হবে, না পড়লে হবে না, and the time is already knocking for your semester, so
ইয়েস স্যার।
get well prepared. Okay, fine. So along with this, I'm ending. I hope Shamashi ma'am will going to take the class, na? The next class.
না না শ্যামশ্রী ম্যাম ক্লাস তো নেবে বলে মনে হয় না।
Okay, okay. I'm সকালে জিজ্ঞেস করছিলেন না, তাই জন্য।
না না না।
Okay, fine, sir. Okay, sir. Thank you, sir. So
ওকে ওকে।
okay.